So testing is still limited in its supply. We are maximizing the testing we have here in the state. So our lab can do, I believe, up to 280 tests per day, and they can turn those around in 8 hours and certainly within 1 day. My understanding, I don't have exact numbers with me, but I'll try to get you some of those, is the Cleveland Clinic and Ohio State University and a number of other hospitals have built up some capability to do the runs, actually use the chemicals to run the tests. The trouble we're having more is on the kits side. The CDC has opened up that you can now use different types of nasal swabs. They have opened up that it no longer has to be, we have tubes you put the swab in. There was a viral media solution. Now they've said we can use saline. But even still, we've been finding other types of swabs. We have saline, we're still making kits. So we're still limited by the amount of swabs we can do. That said, the other alternative to these faster turnaround times in state and more for outpatient, we had originally said, if you remember, outpatient instead of more mildly symptomatic people could go ahead and use the private labs. The problem is many of the private labs are very overburdened from the whole country, and their testing times are at this point still taking 5 days to longer. And that's the frustration. I think sometimes we've seen maybe a hospital with a very sick person could get that test to a bigger hospital that can do it fast, or to us, and we'd like to get them that result faster so they have better decisions. We're working on a way of communicating that to those hospitals better, and we're using this, obviously, our voice here to say that. But there is a new form of testing coming that's called point-of-care testing. It works differently, and that is just still not out in any form yet, and certainly not, you're hearing different companies like Abbott and Cepheid and a few others talking about the point of care. You've heard the president's team talk about it. It's not, it's still not here to market. It's still not here. I can tell you we have a team with the governor that's pushing every place that we have it the second it's available. And then there's a third type of, you've heard a little bit about Roche and these high throughput machines. One of my frustrations with advertising of that testing, which would be spectacular to have, is there are no machines out there. And we've talked directly with Roche. We've looked in every scientific laboratory. We've looked at all of these machines, cost quite a bit of money. How can we get our hands on one? And there isn't one to be found. And so that was the frustration with when you've heard about that testing. So it's very complicated. My goal, though, and everything I'm doing is the second we have a steady source and ability to test these cases, we have a whole army that is going to blanket the state to get those results as fast as possible. And that's the strategy I'm working for all the while.
And just a quick follow-up. That army you're mentioning, that would be determined at what point? I'm sorry.
We're already working, I can't give you a lot of details yet, but we're working on expanding our existing disease detective workforce. We do not want to take away from the workforce we're also developing. We're talking about nurses and doctors coming out of retirement to help with the hospital surge. But we're working on the fact that we can pretty easily train people, like early med students and nursing students and really other public health students early in their career, to be able to do some of that contact tracing. That's really important because we need that to get sort of a blanket sense of what's going on in our state, to really be able to do contact tracing on asymptomatic people and other folks that are mildly ill. Right now, all our bandwidth on contact tracing is again around cases and the most ill, because there's so many of them now and it's increasing daily. But there'll also be technology answers to this as well. And that's something we're looking at, and we're looking at the ability of people people to self-report where they've been. And then one more piece of this component will be serologic testing when that's available. That'll let us know about people who were sick even as far back as potentially January early on in this, who never were diagnosed, but perhaps could see that they have developed antibodies. So there's a host of things that will give us that epidemiologic knowledge that helps us clamp down on that virus, keep it from spreading to others, in addition to the social distancing measures that are our biggest toolkit now.
Let me just follow up on what Dr. Acton said and be quite blunt. A message to all our hospitals: we really appreciate working with you, but please, please do not send these tests to a lab that takes 5 or 6 days to get it back. We have the capability here to do it at the state lab, or you can find one of the hospitals close to you that is doing this, and it can do it basically in real time. Waiting 4 or 5 days is just not helpful. So we would make that plea. Don't do that. Take it to the state lab, or take it to another hospital that has got the ability to turn that around. We still have capacity, as you heard from Dr. Acton. Thank you very much.